My biggest piece of advice would just be tour the facility, show up, take a look at them, talk with somebody. I think showing up and seeing things and just feeling kind of the atmosphere is going to be able to answer the most questions for you. Probably questions you didn't even know you had, but when you see something, it may spark, oh, what about this or something. So my biggest thing is just show up and take a look at it.
Welcome to In Good Company, Elder Care in Your Backyard.
Today, we're joined by Casey Cordell, the admissions coordinator at James River Nursing and Rehabilitation. With about 5 years of experience in healthcare admissions and the last 2.5 at James River, Casey is passionate about helping families navigate the skilled nursing process with confidence and care. She knows how overwhelming the transition to rehab and long-term care can feel, and she works hard to make it as smooth and as stress-free as possible for families. Casey prides herself on being that friendly, familiar face who guides residents and families every step of the way, ensuring each admission feels personal, welcoming, and full of heart. Casey, welcome to our podcast.
Thank you. Happy to be here.
We're really glad you're here today. So tell me about your journey into your current position. How did you get into long-term care skilled nursing facilities?
It was actually something I never thought I would go into. I actually just happened to make some connections through a job that was completely unrelated to healthcare. I met an administrator of the facility I worked at prior to this, and he approached me about having the position open. Not something I was knowledgeable at the time about, but I wanted to kind of expand and give myself an opportunity. So I did go ahead and meet with him, kind of look at what that would look like. And kind of ever since then, I'm beyond thrilled that I did, because I've opened the door for myself in a lot of ways. And I think found a passion in it that I didn't even know I had at the time. So
that's awesome. Now, I always ask this of all our guests, because it seems like there's always a personal connection with family or whatever. Have you had any family that have gone into skilled nursing facilities, and what was your experience with that?
So my grandma would have been the one for me. She, of course, started out actually in assisted living, got to the point where she wasn't able to stay in her assisted living. It was up in the Kansas City area, so I'm not familiar with that area. However, I was able to kind of help my mom navigate it just from my experience. And I think it was a really good thing for her, because she was able to get the support also, like getting grandma moved to, the higher level of care. We actually got hospice involved with her as well, which was huge. And that's kind of another thing that my mom was very hesitant on, but she just didn't realize how much additional resources they could provide even in the facility level. So that would have been actually the one personal experience that I had with it.
So can I dig into that just a little bit more? So walk me through, you're talking to mom, you're trying to figure out, like, what are some of the questions you're asking, some of the answers she gave, and how you kind of help guide her?
So I more kind of took the role of calling the facilities and scheduling some tours for mom, because she didn't even know really how to start. And so, but once we got into the facilities, then mom could talk with the staff and see the place for herself. And I think that's where she found a lot of comfort in seeing what it actually entailed, and that she wasn't just going to be putting grandma there to, just lay in the bed all day, every day. And so I think that was the biggest thing for mom, was being able to see these facilities, talk to the staff there, and know that this wasn't a negative thing for grandma. It was actually to benefit her and just provide the care that she needed. So that was the biggest thing for mom, to make her feel better about feeling like we were making the right decision for her.
Yeah. Yeah. And so she probably had some misconceptions about what skilled nursing was. What were some of those myths that you had to dispel?
One of the biggest ones, even now, where, the questions I get from families is, just to put it bluntly, well, we don't want to just put mom there to die. And that's not the case. It's to help them regain some independence. It's to help them just make sure that they are properly being taken care of, whether that's, just medication management or dietary needs or anything like that. And so that was one of the biggest things that I had to kind of turn my mom's mind on. Was just to know that it's just to add the additional care and assistance that she needed. So that's what I see a lot now, even, is this is a good thing for people when they're needing the support.
For those that may not know, what is a rehab and nursing facility?
It's going to be something, so of course, a lower level of care than like a hospital setting, where we still have the 24/7 care, but, we're kind of to the point where you can be managing these things at that lower level, but we have the 24/7 call with the physicians. We've got the 24 care staff that would be able to help with the medication management, or if you're just needing help with transfers or kind of your ADLs, your activities of daily living, we're able to help at any level of that. We don't have a specific level that we can or can't take care of. So we're pretty much just there to help at that lower level of hospital care, but somebody who maybe might not qualify for assisted living.
Yeah, that totally makes sense.
Okay.
So in your position, you kind of have to, I don't know if gatekeep is the right word, but you do have to assess if somebody's a right fit for your facility. What are some of the qualifications that you're like, yes, they are definitely a good fit? And maybe what are some of the qualifications where you're like, this might not be the right place?
Sure. I mean, we look at a lot of things. So we kind of have to look at them as like a whole picture. We would never want to bring somebody in the facility that we don't feel like we could provide adequate care for. So if we feel like, maybe they are too high acuity for our facility at the time, even if that's based upon what everybody else in our facility might be, we would just never, if somebody is total max assist times 2 or 3, well, if we already have a high acuity in that regard on a hall, we don't want to overload our staff in the sense that they're not going to get the proper care. We would never want to bring somebody in, let's say with wounds that we don't feel adequately, or, that we could adequately take care of.
Right.
So really it's just, we want to make sure that we can ensure them that you are bringing them here so we can take the proper care that they need. So there's a lot of aspects that we look at. Medications are a big one too. There's a lot of medications that we can't give in our environment, whereas, hypothetically like antipsychotics, that's something that's regulated pretty strongly at a skilled nursing level, but maybe a behavioral facility can provide those that we can't.
Okay.
So it might be another thing that we kind of look at.
So if you have somebody who comes in that has a higher acuity, and just for those who are listening, acuity is the level of assistance that are required. And when you said max assist to 2 or 3, so some facilities, when they have aides, for instance, that they're going to actually have providing the assistance itself, they have a limit that they say, our aides are going to be limited to this much, assistance. And you have to understand, I'm a physical therapist, so I kind of know some of the dynamics here. When you're talking about how much assist to provide, it depends on if you're using a mechanical lift or not, or a transfer board or something like that. It requires a lot of extra training. But if you have somebody who's bariatric, for instance, they're a lot heavier. They have very little ability to carry their own weight. They're much heavier. Do you have facilities that you typically will help a hospital refer to? Or if they call you and they're like, we have this patient, you're like, we just can't take them, we can't take care of them, but it's still up to the hospital to refer those to a different facility?
Yeah. I mean, if I can help refer in any way, I will. We've got some sister facilities here in town that, if I get a call about a memory unit, not to take away from the bariatric, well, we don't have a memory unit. So I'll always say, hey, we can't meet the needs of this person, but this facility might be able to. So if I know of a facility that would be able to possibly, meet the needs that we can't, I would definitely try to help.
What kind of specialty does James River, if you're going to say, we've got a rehab department, what types of diagnosis do you feel like you really specialize in?
So wounds is actually something that we are pretty proud of. We have a phenomenal wound nurse. She's been with us, I couldn't even tell you how long. So she can treat, I would say any wound, but no, she's phenomenal. And she's there 5 days a week, and she has a wound doctor that actually comes in and rounds with her. So I would say that's actually something that we kind of pride ourselves on, and we would take on a little more tough cases than some facilities would at the time. That being said, that is still something we would never want to overload her with, because that's not doing a patient any service.
Sure.
So,
yeah.
But yeah, wounds would be something that we definitely kind of pride ourselves in that.
That's great. That's great.
Could you walk us through some of the additional therapies and services that James River provides?
We've got the physical therapy, occupational therapy, and speech therapy. On top of that, we've got a psychologist who comes in-house, so we can kind of even work on that side of things and not just the more physical aspects. I think that's important. We've got like an activities department, so we're still kind of focusing on their social life. We just kind of think it's important that if you are there for therapy or rehab, that you're still touching all these other points as well.
And what does your day-to-day look like in terms of your position?
Me personally, let's say I receive a referral. Well, I want to touch base with that family. I want to, after we've had a chance to like really review that referral, I want to touch base with the family and kind of start my side of what I get to do for the patient and for the family. And so I always want to get them on the phone, answer any questions that they may have. And one of the things I find most important is trying to get them in for a tour, because kind of like I was saying with my mom, I think seeing the facility eases a lot of your concerns and stress and everything. So I always try to, like I said, initially answer any questions and then see if I can schedule a tour with them. Sometimes for me, it may not be an option for them to actually come to our facility. So if they're in the hospital, I'll go to the hospital, bring photos, bring flyers, bring anything, but I still want to go meet these people, because that's what's important for me. Is I want to be a person who is somebody that can kind of ease and alleviate some of that stress and concern and all of that from these families and patients themselves. So that's kind of where I start, a referral process. On top of that, if we have admissions scheduled for that day, I will be the person that will meet the patient when they get there, meet with the families when they get there. I go through all of that admission paperwork. So I just try to be that front line of somebody who's going to make them feel comfortable when they're making a decision. On top of it, make them feel comfortable when they do get to us. So that's kind of what I get to do, and I love that.
Since you're kind of in the admissions area, are there any insurances that you guys don't take?
There is. One of the main ones that we get calls on or referrals on is Aetna.
Okay.
But really for the most part, there's not many that we come across, but that's one of our biggest ones. We just don't have a contract with them.
Yeah. Yeah. Do you find that, you're having somebody come from the hospital, they're slated for rehab particulars, so that most of them are probably going to try to go home. Have you see a difference in people who are coming through the door on Medicare Advantage versus traditional Medicare, like the length of time they're there? Is it different?
Yes.
And so can you tell me a little bit about the differences you're seeing?
Yeah. So our traditional Medicare, the facility, physicians, physical therapists, everybody that gets to actually work with them, lay eyes on them, we kind of get a lot more say on their length of stay, which I think is really important, because we're not just reading them on paper, essentially. So if our physician or physical therapist think that they need a little more time, and of course are still meeting those Medicare guidelines, we have a little more say on, hey, we can kind of allow this much more time, versus our Advantage plans. We have to send the updates to the insurance company. So for the most part, they're kind of only being looked at on paper. And I think, as we all know, paper can look a lot different than a person, what they're actually physically able to do and that kind of stuff. There's a big difference there. So we sometimes see the Advantage plans having to go home a little sooner than we would care to send them home. Yeah.
And is there any appeal process if somebody's, you're really feeling strongly they're not ready to go home?
Yes, there is. It's the same appeals process for each Advantage plan. And typically how that works is the patient or family calls the appeals number. We always tell them, just keep it factual, because they're not going to want to know the opinions of why you feel like you're not ready, because that's not going to meet those guidelines of what they need. So we tell them to kind of keep it factual of, this is what I can't do, but this is what I need to be able to do at home. Or, maybe they can't do stairs, and maybe they have 3 stairs to get in the house. So they do that. And then that company reaches back out to us so we can send that supporting documentation to go along with what they said.
And how often is that successful?
Not very often.
Oh boy.
Yeah.
Okay. So they're like, okay, they have to go, they set a date, you have to discharge them. What happens next? How do they get home typically if they have a hard time getting into their home?
We've got a couple different options. Obviously, if family want to take them home, that's the best thing, and maybe that's a good thing for them as well if they are able to get in and out of a car like that. If family can't take them home or they can't get in and out of a car yet, we can actually provide transportation, or we're of course contracted with like non-emergent medical transportation. So we can provide some transportation to them for them to get home. But that's within a certain range. So, if somebody lives hour and a half away, that's not something that we're going to be able to provide.
Sure.
So
does your rehab team ever do like home evaluations?
yes, we absolutely do.
And what does that look like?
It's something that they typically go in and want to evaluate the home so they can see if there's safety concerns, if they have recommendations on grab bars in the bathrooms, showers, that kind of stuff. They want to make sure that it is set up in the safest way possible for them. So they will do those.
And do you do referrals to outside resources?
Yes.
What are some of those resources?
Upon discharge, we always want to set our patients up with home health. So, of course, that's going to be the agencies that can come in and provide a little additional therapy, medical management if they need it, anything that's going to just help make that transition back to home as smooth as possible.
I'm going to pivot back to something else you had mentioned earlier. So I'm going to kind of totally throw a wrench in things. So you had mentioned that you helped your mom navigate your grandmother going on to hospice, and you had to have a conversation with her to help explain all that. Can you walk me through how that conversation went and what maybe her thoughts were on things?
So hospice is not a conversation I'm great at, especially then when I'm putting my own family members, kind of in the midst of it. So it's not an easy conversation that I was able to have, except for we need to hear them out. We need to hear what they have to say, because they can just, they can provide the additional support and resources that maybe that facility couldn't.
Right.
So it wasn't necessarily a conversation that I could say, hey, this is why we need to do it, but I could at least get her to listen to them.
Yeah.
So I think that was the biggest thing. And I think that's better anyways, because then they could actually explain to my mom exactly what they could provide and why it was a benefit.
So was that the facility, or was there an agency that you had reached out to, or your mom had heard of?
There was a hospice agency that the facility that grandma was going to used. And
okay.
So they were the ones that came in and had the conversation with mom.
Okay. Yeah, I've heard of this a lot of times, and when it's your own family, it's really, really tough to have those conversations.
Yeah, hospice is tough for me in general, much less when it was my grandma. I struggled a little bit with that one. So
yeah, but the hospices always have somebody who are really great at it.
Yes.
And so anytime we've had families that are like, we think this might be the answer, I always encourage them to reach out to a hospice, because they'll send someone over to personally sit down with you and talk to you about what it means to go into hospice, when it's appropriate, whether that person qualifies or not. But the big thing is to call and like get that ball rolling, because it doesn't have to be you that has that conversation, but it's hard when it's your own family for sure.
Well, you've helped countless families deal with difficult transitions. Is there a moment or a story that you could share that really impacted you in your few and a half years there?
There's a lot, but there's one that probably stands out the most. And she's actually still in our facility to this day. But she was to a point where she was falling. I mean, I can't tell you how many times, but the family had told me that they were constantly having to call the fire department if she was on the ground, because they couldn't get to her in time. They had broken in the door. They'd came in a window at one point. And she was somebody they brought in to tour the facility. The patient themselves, which I don't get a lot. Normally it's just families. And when she initially came in, she was completely against it. When she was walking out of the door, she was asking me, so when do I get to come here? And still to this day, she is one of the most positive people in our facility. And I love seeing her infectious smile. And I think it just did kind of give her the reassurance that she needed. I mean, she has taken a 180 from when she initially came through the door to even where she is now. So that's probably the most heartwarming for me, is just seeing the difference. I mean, that I physically got to see change, and it was pretty drastically in her. Because not everybody wants to go to a skilled nursing facility. I understand that. But if we can at least make you see why it is going to benefit you, that would be my goal. That's what I want.
Absolutely. Could you share some of those benefits too for other people that are listening that are considering a skilled nursing facility?
Yeah, I mean, it can give you just the security you need if you're looking for yourself or for any family members. One of the main reasons that we see a lot of people coming from home are typically going to be they're a fall risk, they're weak, they live on their own, and they're not safe to anymore. And so if it can give that patient and the family the security that they need, that somebody's always going to be around if I need them, or somebody's always going to make sure I'm getting my medications when I need them. Somebody's going to make me food because maybe before I didn't have the energy or anything to be doing that. And so I think one of the biggest things that I see is I want it to be just making your quality of life better. And you may not even know that it would until you try, because I mean, if you're sitting at home on the couch watching TV all day because you don't have assistance to get up, or you don't have the energy to make yourself food, what could getting those things like be able to provide for you in that quality of life? There's a lot of times that we can take people out to, we do facility outings, and we'll go to ball games, we'll go out to eat, we'll go to movie theaters, where before they wouldn't have the option to do that because they couldn't get in and out of a car. They, just didn't have the strength or energy to do it. And so we get to be able to provide these things to some people who didn't have the opportunity before.
That's awesome.
Yeah, that's really, really good. I love that. That's a great story. You've got somebody who goes into the hospital, they have a family member that knows they're probably going to need skilled nursing. What advice would you give them if they're not sure where to send them, and sometimes they just get a list and they're supposed to, kind of close their eyes and point at the name on the list because they may not be knowledgeable about what things to ask. What would be some of your advice for those individuals?
In terms of kind of deciding what facility?
Yeah.
I've kind of already said it, and it's going to be my biggest piece of advice in that aspect, because most of the time, if you're getting in that situation, you've not ever been there. My biggest piece of advice would just be tour the facility, show up, take a look at them, talk with somebody. Like I've said with my mom, like I've even said with working it myself, like I think showing up and seeing things and just feeling kind of the atmosphere is going to be able to answer the most questions for you. Probably questions you didn't even know you had, but when you see something, it may spark, oh, what about this or something. So my biggest thing is just start showing up to those facilities, tour them, ask some questions, meet with some people, but just show up and take a look at it.
That's awesome.
Mm-hmm.
Yeah, that's good advice.
What's the most common misconceptions families have about rehab or skilled nursing?
Well, I'm going to do it separately. So rehab specifically, sometimes I'll get that once I do go in there, I'm still not going to go home. I'm not going to get the strength. I'm not going to, I'm just going to transition. I'm going to become long-term care. And that's not the case. That's not our goal. We don't want that. We want you to go home. We want you to be successful. We want to hopefully never see you again. That would be our biggest goal. So I think a lot of people, because it's a combined rehab and long-term care, they just think they're going to become another one of a long-term care resident. And that's not what we want. And then again, in the long-term care aspect, kind of like we talked about, the biggest misconception of that is you're just going to send somebody there and they're going to lay in the bed until they die. And that's, again, not the case, because we're going to be trying to give them that quality of life back.
So if you have somebody who does go into rehab and let's say they don't progress and they need to go into long-term, is most of the time they're going to stay at your facility, or do they have to transition to a different facility?
No, that's kind of a option of the family and patient at that point. If they want to stay at our facility, that's always an option. We would love to be able to take care of somebody, especially that we've already had the opportunity to take care of. But sometimes we have seen where maybe they've chosen to come to us for rehab, but maybe they would rather them, if it's going to be long-term care, be a little closer to where family might be or something. And so we'll help make that transition. We'll send a referral to those facilities for them and kind of do the legwork for them. We can even help with transportation if we do end up getting that worked out, but it doesn't necessarily have to be with our facility.
So when they come in for rehab, typically they're skilled. which means that often that's being paid for by Medicare Part A.
Correct.
Or their Medicare Advantage. When they transition to long-term care, what is the payer source and typically how much does it cost?
So it's going to be either long-term care at that point or likely Medicaid. There are some long-term care insurances that we'll work with as well that pay like a certain amount per day. We don't see a lot of those anymore, but so for private pay within our facility, it's for a semi-private room or private room is kind of what you're going to be looking at the difference of. And ours is about $1,000 a different, or $1,000 difference. So 75 for a semi-private room and 8,500 for a private room
Per month.
Mm-hmm.
Okay.
So if they, of course, can't afford that, because not a lot of people can,
Sure.
We can help apply for Medicaid within the facility. We will fill out a Medicaid application with patient or family. We'll have to get some supporting documents from them, bank statements, anything that may kind of go along with that. And then we can actually submit it for them. They don't have to track it. Anything like that, we'll take care of it.
That's great.
Mm-hmm.
That's great. How many rehab beds do you have and how many long-term beds do you have?
22 rehab beds and 98 long-term care. So yeah,
Okay.
we're licensed to hold 120.
And how full are you right now?
Right now is a little different because we are going through a remodel. So some of our rooms are shut down.
Okay.
And we can't wait for that to be done. But right now we would be sitting at 92, I believe.
Okay.
So once we, get the facility completely back open, we're hoping to kind of bump that up quite a bit. So
Well, tell us about your remodel.
Yeah.
That's gotta be
When
a
is
big
that going to be
deal.
completed?
Well, when was it supposed to be completed?
That's always the question.
This month, actually. It was supposed
Yeah.
to be about a 12 or 13th month process, but I think we all know how that goes. So I think we're going to be looking at probably another 4 months or so.
Okay.
But once it is done, it's looking phenomenal. Alex has seen it. It's beautiful. We're just giving the facility a modern feel. I'm not sure it had been updated since it had been built. So it needed a good facelift. So.
Okay.
Are there some new amenities being added to the facility?
Not at the moment. Right
Okay.
now, everything is a little, well, I guess I say that we're kind of giving back some spaces to the residents actually that had
Okay.
been taken for like staff break rooms, stuff like that. And so we're going to add some addition. We're not adding rooms. We're adding space for them. We're going to be adding like a game room so we're going to just move our break room and give back a good area for a game room. But really on top of that, it's just going to be giving a nice facelift to everything, making sure that everything is kind of in better condition than it was before. It was heavily used and loved, I would say. So,
Right. Okay. And I'm just, when I hear remodel, I always think, were there other changes that happen, like physical changes to maybe the amount of bathroom space or, how when you have a semi-private, you're sharing a bathroom. Is there a different way it's laid out? I'm not sure how James River's
so
laid
we're
out.
not changing, I guess, structurally, you could say. We're not changing any of that.
Okay.
So with the room sizes haven't changed, the layouts haven't changed, but we're getting all new flooring. We've taken down some wallpaper that was from, I'm not sure what decade, completely new furniture, decorations. We've taken out we've completely installed brand new toilets into all the residents' rooms, new grab bars, because a lot of those were probably, initially put in when the building was built. So it's not changing the structure of room or layout of rooms or anything, but we're definitely making it updated for them and making sure everything is not wobbly, not, anything like that.
Okay. Do you take hospice respite?
We do.
Okay.
Yes.
And typically, how long are those respite stays?
Typically, it would be about a 5-day respite is what we see.
Okay. That's great.
Mm-hmm.
Circling back to the admissions process,
Okay.
what are some of the biggest questions or concerns families bring you when they start that process and when they admit their loved one?
So I'm going to go kind of toward long-term care again right now. But some of the biggest questions would be, do I get to take my loved one out for the day? Do I get to take them home? Which the answer is yes, you can absolutely take them out. You can take them home for the holidays. We can send medications if they want to go spend the weekend or something like that. Another thing, they want to make sure that we have transportation to any specialist appointments because, of course, we have a lot of residents who see cardiologists or neurologists, anything like that. We provide transportation to all of that, so it's nothing that the families have to worry about. We're there to take care of them, so that's what we're going to do. Those are probably two of the biggest questions that I get on that side. Rehab side, it's actually generally kind of based around the length of stay, which again goes back to the Medicare versus Advantage plan. It's hard to say because each person is going to be a little different, but on average, I can say that we see maybe 14, 15, 16 days with the Advantage plans kind of being a little lower, sometimes Medicare being a little higher. But length of stay would be the biggest question on our rehab side.
Awesome. And what does a typical day look like for someone in your rehab facility?
So each person is going to get 5 days of therapy per discipline. So if they're getting PT, OT, and speech, they're going to have each of those sessions every 5 days, which is typically going to be that Monday through Friday. So weekends are kind of resting time. If somebody does come in during the weekend or on a Friday, we will try to get them evaluated, of course, but typically those sessions won't be on the weekends. So aside from the actual treatment sessions, the therapist will sometimes give like at-home exercises so they can kind of continue strengthening and whatnot when they're not in those sessions. We also do encourage them to just get out and be social in our activities, which we kind of struggle with sometimes, just
How so?
trying to get rehab patients involved in activities with our long-term care residents. I think that kind of goes back to another stigma of, well, I'm not in long-term care. I don't want to do part of that. But I always just encourage, like, it gets you out, it gets you social. It makes the day go quicker. You're not laying in bed all day. You're not sitting there watching TV. We want people trying to get back into somewhat of a routine like they're going to be at home. So if we can keep them from just laying in bed or in a recliner all day, that's what we try to do.
Yeah. And I mean, for some people, it is like 3 hours of therapy.
It can be a lot.
if you're like, okay, now I'm going to go do a 3-hour workout, I mean,
so I'd be tired too.
And these people aren't there because they had a great day, they're there because they were sick. And so
that is very true. I mean, we at least at the very minimum try to get them going to the dining room if we can, but I get, being tired, but we try to keep them from just laying in bed and I get the recovery. Take some time. I get that, but we try.
Yeah, no, that's great. Because I think sometimes people come from the hospital and they get no rest at all in the hospital. Like they're up 24 hours a day.
Well, I can't tell you how many times I hear, they were constantly coming in at 2 a.m. to give me medication. I'm like, oof, I get it. Yeah. You probably weren't sleeping very well.
Yeah. So yeah. I mean, I don't know how people could possibly recover in a hospital setting because it's just, they get no rest.
Yeah.
That's so true. What are some of your favorite activities you put on?
We have a lot of different activities and our activities director has been there for 16 years, something like that. So she's pretty much got it down, but she has like live music groups come into the facility and put on kind of concerts for the residents. Like I said, we do a lot of fun outings when weather permits. So normally through the warmer months. So she'll take different groups out to do that. Bingo is one of the biggest hits. That might sound cliche, but it truly is. So we have bingo 3 times a week.
Wow.
She even does like exercise classes as an activity, but it's always fun things like I at least remember back in high school, or not high school, back in elementary school when you'd play with the parachute and stuff. And so they'll do different things like that just gets people moving and exercising and stuff. And that's actually a big hit too. For our ladies, we or anybody who would want to, but typically we see our ladies getting excited about nail day. Every Wednesday we'll do nails, and we've pretty much got a line out the door of them wanting to get their nails done for the day. So we've got several different ones that I would say are my favorite, but probably the ones that we bring groups in to engage with the residents.
That's awesome.
How does you and your team help ease the emotional side of these transitions for both patients and the families?
Our social workers would come in pretty heavily there. They, especially when somebody has just admitted, they want to meet with them daily, if not more, if it's something that person's requiring, a little more assistance on the transition. But yeah, our social workers are phenomenal, and just kind of getting real and getting deep with them, and just trying to figure out how we can help with them specifically, and what they're going to require. Depression is something we see a lot, and so that's something that we want to try to address. Like I had mentioned before, we've got a psychologist that if we're kind of seeing somebody struggle a little more than others, we want to offer these services that they're going to get taken care of on that emotional side too, and not just the physical. So our social workers play a big part in that.
That's really good. We've seen an epidemic of people who suffer from depression.
Mm-hmm.
And these older adults have suffered a lot of loss, whether that's loss of family or loss of function and abilities. And it just seems like a bigger and bigger problem that we're seeing more and more of. Is that something you guys have noticed?
Yes. Yeah. I mean, no, we don't see the healthy people. So we see people who have struggled, and whether that is with their health, their physical decline, that kind of stuff. And I mean, it's easy for depression to kind of creep in when somebody's probably went through some of the things that our residents have went through. So we probably, I mean, in our industry, see it more than just your average person even.
Yeah. I remember there was a lady that she was like a ray of sunshine, and like she just had this, like she was always positive, saying wonderful positive things all the time, and her roommate hated her. It was so funny because she would just say these really nice and her roommate would always just say horrible things to her, but she just, everything bounced off her, it never bothered her at all. And we just loved her. I mean, we just absolutely just thought she was the best thing ever, but it was just comical because, some of these other folks aren't having a great day and they don't want to hear it,
That's fair.
So James River Rehab is a part of our local community. How do you see your work connecting with families beyond the facility walls?
So we try to partner and lend a hand in different ways to, like, assisted living facilities is a big place that we kind of focus. Same with like independent living facilities. We want to just kind of be known and be providing any information or assistance or anything for if and when that transition may come. So I know I personally focus a lot of my time on assisted livings, just in any way that they may need assistance if they've got somebody needing or starting to kind of take that decline where they may be looking at long-term care in the future, or even rehab, if they maybe just need a little bit of rehab and be able to be successful back in the assisted living. So that would be somewhere that we probably focus a lot of our energy and try to lend a hand when we can.
Yeah. A lot of these, I don't think a lot of people understand that the assisted living and independent livings have a pathway to safety requirement.
Mm-hmm.
And so they have folks that are progressively getting more functional mobility issues. And before they know it, they've got a handful of really nursing home candidates in their facility. And they really need a great way to transition some of these folks. I know in our, like even in our home health and hospice and in home care, we have a number of people that are really nursing home candidates, and trying to have our social worker go in and say, okay, it's probably time we start looking and going and doing those tours, and trying to get used to the idea of a higher level of care so that they don't wind up in a much worse situation. Because honestly, one of the biggest issues that sometimes we run into is either somebody's not managing their medications appropriately, and some of these medications are 3 or 4 times a day, and there's somebody not there 3 or 4 times a day to make sure that they get administered correctly, and then they're not eating enough, and all of these things, and our clinicians are like, okay, it's time. We need to move them on to a skilled nursing facility. And it's one of those things where we want to make sure that we've got, you know, a way in which we can help get them transitioning to that level of care, but it's tricky, like, because they have these misconceptions.
Yeah. Yep. We've run across that. And that's, if we can be that assistance on helping the families understand why they probably need to look at the higher level of care at that point, then I'm happy to do so. I don't think they understand the difference of what the assisted living staff can provide versus what long-term care staff can provide. We can physically be able to lift these people and assist in emergencies and whatnot, where assisted living can't. And I think you're right. I don't think a lot of people understand that, and probably don't want to, because, maybe mom or dad's been there for a while and they don't want them to leave.
Yeah.
So,
well, one of the things, I mean, we run into the same problem with misconceptions about hospice. They witnessed what hospice was like, 40 years ago or whatever. And the same with a skilled nursing facility, that quite honestly, the requirements to be licensed are so different now. Like the nursing home from 40 years ago would never be able to exist today. There may be something out there that's not great, but I'm just saying that the level of care and the requirements around that care are significantly different today. And, so many of these facilities are beautiful, and they've really designed things to kind of cater to people's quality of life more than just, put them in a chair and leave them outside the nurse's desk or something.
I would agree. I mean, I don't know exactly what the requirements were then, but I know what people come in and are asking and saying and stuff. So I can only imagine probably how much things have changed in the last 40 years or so. But I mean, quality of life is one of our biggest things that we want to focus on. I've kind of touched on that before. It's, we want to make sure that we're providing not only the medical care for people, but their social sides and, their emotional sides, their spiritual. We want to be able to try to touch every aspect if we can.
Question might be redundant because we're talking about it now, but I do want to ask it just so we get it out there. What do you wish more people would understand about this stage of care?
I would want them to understand that, again, it's all to benefit and better their loved one. So, I mean, we would just want to make sure that they understand this is for their benefit. We're here to be an extra support system for them, and make sure that they are getting the proper medications, make sure they are getting assistance to and from their wheelchair, their recliner, or, making sure that they do go to these outside appointments because they are important. So we want to make sure that they are getting the proper care and assistance that they need.
We're in open enrollment right now for Medicare. So we like to try to have our experts who are basically living and breathing in this environment to help. Are there any questions or any guidance you might give to somebody who's trying to make a choice on what kind of insurance they should maybe be leaning towards when it's related to Medicare, Medicare Advantage? So
I can only speak in terms of skilled nursing. So the outside benefits, I understand there are some for both Advantage plans and traditional Medicare. Kind of what we have talked with families and patients about is, if you are finding yourself kind of we've called it like a revolving door of, maybe you are finding yourself sick, you're finding yourself in the hospital, you're finding yourself going to rehab, and for some reason this is kind of becoming a recurring thing for you. You may look at what benefits are going to benefit you more as an individual. And I will tell you, in our environment, that traditional Medicare is something where we think they're able to actually use a lot more of those benefits rather than the Advantage plan. Again, just kind of going back to, they're not just being read on paper. They're being seen as an individual and what is going on exactly, instead of just what's being written in their chart. So we see where they are able to use more of their benefits under traditional Medicare rather than the Advantage plans.
Okay. That's good advice.
Mm-hmm.
What keeps you inspired in your work? What's your why? Why you do what you do?
I 100%, I want to be the person that can alleviate the stress. I've said that is absolutely like where my passion is. I want to be the person that can confidently go in and say, this is the services we're going to be able to provide to you and what we're going to be able to do to help you. I want to be the person that makes this decision a little easier. It's not going to be a lot easier. I understand it's a tough decision, but if I can be the person that just takes a little bit of stress off that family and patient, then that's what I want to do. So that's my biggest thing is I just want to be that person that they remember, like, you know, that decision and that transition was a little easier just because of Casey. That's what I would love to hear. So
that's great. I'm glad you're in the position you're in.
Well, thank you. I'm glad I am too. I love the opportunity.
Yeah.
It does. It warms my heart. Even just seeing like those families come back in after mom or dad's been with us for weeks and they still they seem happy and confident with their decision. I love when they'll come talk to me and maybe tell me how good mom or dad's doing being in the facility. So those are also the times that I'm like, this is why I love it. So
that's awesome.
That's fantastic.
Mm-hmm.
When you have, and I kind of got the angle on how you could potentially serve the patient and the families,
Mm-hmm.
but you kind of have another customer, which is the hospital discharge planners.
Yes.
So what are you, I guess, helping to make their job easier or make things work a little bit smoother?
Well, on their side, a lot of times they are looking at who can be the facility that makes this easiest and quickest for us.
Okay.
So I know that's something that we focus on that side also. We try to be the one that does respond to these quickest, whether that is saying we can or we can't, accept this person for this reason. We want to make sure that we're making it as easy as possible, whether it is a yes or a no. So I think communication there is going to be the best and easiest thing.
Yeah, that's great. Well, thank you so much for being on our podcast and explaining about skilled nursing and the ins and outs and being very transparent about all of it, because I think it is stressful for people. They don't totally understand. They think, like if they walk into a skilled nursing facility, they're trapped there forever or something. It just isn't the way that works. And in the old days, they did all the rehab in the hospital and they transitioned that to skilled nursing facilities a long time ago. They, will do some rehab in a hospital setting, but for the most part, it's all in skilled nursing facilities. And you got to pick the right one because some of them focus more on the rehab side of things than others. And I have personally witnessed where they really zeroed in on having a great rehab team. And, there was a lot of communication between the nursing staff and the rehab department. And, they did great home evals, which I love that you guys do because sometimes they don't always. And, it just sounds like a good all around facility.
Yeah. Well, I appreciate you giving me the opportunity to be here. So I've had a lot more fun than I thought I would.
Well, we're happy to hear. Thanks so much for joining us.
Yeah, absolutely. And we'll put some information about James River in your show notes and that sort of thing.
Okay. Casey, thank you so much.
Yes, thank you.
Thanks again.
I appreciate it.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.